So what's going to happen when we meet for the first of our 10 tools? And the first tool is access the control center of the mind. And if you want to do some good inner work with your clients, well then the first thing that we have to do is that we have to access the level of mind where their problems, their challenges are stored, and that's the subconscious mind. And one of the most effective ways to access the subconscious mind is to use hypnosis. So what is hypnosis? Well, there are so many different definitions of it, and those definitions are guided by 12 different theories around the concept of hypnosis. So how can we define hypnosis? Well, let's look at some working definitions. First of all, it's guided imagination. It's also the bypass of the critical factor of the conscious mind. It is a natural, altered state of consciousness. It is a relaxed, hypersuggestible state. It's intense concentration and focusing. And it's also a process to access the subconscious mind. And they are 6 good working definitions, and each one is valid in its own right. So what underpins hypnosis? Well, what underpins it is this thing called suggestion. And suggestion is simply described as an openness to accepting and responding to new ideas and information. That's all. It's an openness to accepting and responding to new ideas and new information. So what makes a good hypnotic client? Well, obviously, it's going to be someone who is open, someone who has that open-mindedness, someone who has a growth-based mindset, someone who is able to think outside the box, who's able to use their creativity. The more a person is close-minded, the harder it is to hypnotize them. And although some of our clients will present with what we call a fixed mindset, that doesn't mean that we can't hypnotize them or work through hypnosis. It just means that we have to help them to develop what we call the growth-based mindset, and that can take a little bit more time. It's really important also to recognize that there are 3 things that can stop a person from experiencing hypnosis. The first one is fear. The second one is lack of trust, where they don't really trust you as the person who's about to do that work with them. And the third one is what we call the 3 big distractions. And I'll get to those in a moment. But first of all, let's define what is a hypnotic induction. Well, there are 3 things to remember. First of all, it's a bridge between normal awareness and hypnotic awareness. It's a process of dissociation or disconnecting from the 3 big distractions that I have over here on the screen. And thirdly, it is a process that builds what we call a response set by amplifying our natural suggestibility. So how does hypnosis happen in a therapeutic environment? Well, it happens when we simply invite our clients to close their eyes, or we obtain eye closure by amplifying their natural suggestibility. And with their eyes closed, we can begin to help them to disconnect from the 3 big distractions. And the first of those distractions is the fact that so often in our daily life, we move through different time zones, and seldom are we here in this moment fully present. Often in life we'll find ourselves worried about what's happened in the past, ruminating and thinking things over and wishing things were different or harking back to the good old days. Or we find ourselves moving forward in time, planning for the future, maybe being anxious about the future, trying to set ourselves up for success. And again, always looking ahead or looking back and not really being in the moment. So the process of inducing hypnosis is to bring your client firmly into the here and now. And the second of the three big distractions is the fact that the environment we find ourselves, more often than not, is pulling us away from ourselves. There is so much that needs to be done. There are so many distractions around us. You know, the room could be too bright, or it could be too dark, it could be too hot, too cold, too noisy, too stuffy. You know, the chair you're sitting in mightn't be comfortable, your phone might be ringing, there might be the sound of traffic or noise from the window. So many things in the environment can distract us away from doing our inner work. And the last of the three big distractions is our body. You know, your body is constantly giving off signals and cues. It's constantly shifting and moving around. It's reminding you of the fact that you need to get something to eat pretty soon, or it's reminding you of the fact that you ate too much earlier on. It can feel uncomfortable because it's too hot or it's too cold. You can be fidgety, you can be itchy, and it can distract us in so many ways. So when we invite our client to close their eyes, we begin to help them dissociate out of the environment. By speaking certain words to them, we help to orientate them to stay fully present in this moment in time. And by taking them through a process, we help their body to become much more comfortable than it currently is. So what are you going to learn? So we're going to start by doing some suggestibility exercises. You're going to discover that different people respond differently to hypnosis. Some people are very visual, some people are very auditory, and some people really connect with their feelings. They're kinesthetic. And once you understand how each individual client responds to suggestion, well, then the next thing you want to do is you want to learn how to amplify that suggestion. So you're going to learn a range of techniques, such as eye fixation. You're going to learn Chevreul's pendulum. And these are two very important techniques, because if you're familiar with EMDR, or eye movement desensitization and reprocessing, well, then you'll know that how the eyes move is an incredibly important process to help manage trauma. So we will be touching on that, but that's something we'll be going into on a later module. You're also going to learn some shorthand techniques, because let's face it, if you take your client through a whole process of getting them into hypnosis, and for some reason they're distracted, and they come out of this state of deep hypnosis, well, you don't want to have to go back and start all over again now, do you? So you're going to learn some shorthand techniques to get them back into hypnosis quickly, easily, and deeply. Altogether, we're going to learn about 10 different hypnotic inductions, and these will be suitable for different settings. For example, some of them will be great when you're doing individual in-person sessions. Others will be better for when you're doing some groups, and some will be more appropriate if you're working in the online environment. And you know, hypnotic inductions can be put into 4 broad categories. You have conversational inductions, you have natural inductions. You know, sometimes hypnosis just happens naturally and easily in the course of taking a client case history. We have everyday trances. More often than not, your clients come in because they're already stuck in some kind of a trance and they want to get out of it. In other words, they want to stop thinking a certain way or feeling a certain way, or they want to stop what they consider unhelpful behaviors. And then we have our formal hypnotic inductions, where again, we're inviting our client to close their eyes down, or we're amplifying suggestion with a specific eye closure technique, and we're getting ready to do some good work. So as you can see, we're going to be pretty busy when we meet up in the classroom, but one of the things I really want to highlight to you today is that you don't need to remember everything, because one of the big bonuses you get by attending this course is access to 101 short interventions for coaches, therapists and healers. And this is what it's going to look like on your iPad or your tablet. So tool number 1, as you can see, everything that you're going to learn is here in this online area, and all you have to do is to click in to any of these little boxes and you'll get access to a little video of me talking you through the script, and you'll also get the script on your phone so you can scroll through it and you can learn at your own pace. So you see, it's not just about the practice sessions and the demonstrations in the classroom. It's about the fact that you're going to have these resources with you as you grow and develop your own therapy practice. And last but not least, I have a student-led approach to guided learning, which means that I'm going to put you first, and I'm going to ensure that no student gets left behind. Because you see, there are 4 different ways that people learn. Now, some people are quite visual, and they're into feeling and they're into watching. And very often they're guided by the question why. And they like to understand the reasons why. Whereas other people are guided by watching and thinking, and they tend to be more auditory, and they're guided by the facts, so they tend to ask the question what. Now other people are more tactile, they're more into thinking and doing, and they're guided by the question how. In other words, they like to try, so they enjoy the practice and the demonstrations that come with the course, whereas others like to sit back and just kind of watch and absorb. And then you have other people, and they're more kinesthetic, they're more guided by doing and feeling. And for them, they tend to ask the question, what if? They enjoy teaching others, and they tend to look for that bigger picture. And so the course is structured in such a way to make sure that regardless of your individual learning style, that you'll be well accommodated for in the classroom. And you're probably saying, but Susan, I don't know what my learning style is. And that's okay too, because one of the things that we're going to do is a short little test to figure out whether you're a why, what, how, or what if kind of person, if you're guided more by feeling, watching, thinking, or doing. So don't worry about it. It's all going to come together. And you know what? In addition to you figuring out your learning style, how amazing will it be for you to be able to share this with your clients? Say if you're doing some mind coaching with them by Skype, as an example. Right, I can't wait to see you in the classroom for tool number 1, which is accessing the control center of the mind. So this is Susan Wallace saying goodbye for now, and see you soon.